With us now is Dr. Sharone Stern, and we're going to be talking about feet. That's right, feet. And no, I'm not going to take my shoes off. Well, maybe I will. Doctor, welcome to the show. How are you?
Thank you. Very well, thank you. It's an honor to be here. I love it.
How did you become a podiatrist?
A lot of schooling,
Okay.
I'll tell you that much. The Podiatric Medical School in Manhattan, and residency at a hospital for special surgery in Detroit, Michigan.
Oh.
And here I am 25 years later, a long time in practice, and loving it, loving what I do.
It seems to be so, because when we first met and we were talking about the fact that what you really love is the ability to help, I guess, maybe even save lives, because a lot of the times the patients that you're working with have diabetes, and because they have injuries and infections in their feet, sometimes it shortens their life. So what is the correlation between feet and diabetes, or diabetes and feet?
That's an excellent question. Diabetes, it's multi-system disease, and part of what it affects is your feet. The way it affects your feet is both vascular and neurologically.
Okay.
And so what we want to do is, everything really with diabetes should be preventative. We want to prevent problems before they start, and that's part of the subspecialty of diabetic foot care.
Okay. When a case first presents to you and they show you their feet, what are you first looking for? Is it coloration? Is it the way that it's formed? What do you look at when you see a pair of feet?
Well, it's all of that.
Okay.
We do look for good color, good circulatory status, make sure areas of skin are intact, and hopefully they are. But we also look for the small nuances in little areas of any foot deformities that could be rubbing in your shoe, redness, calluses, corns. Those are an indication of increased pressure, and very often those are the problems that begin bigger problems for diabetics.
Really? Even calluses?
Sure, yes.
Okay. So I noticed on your website you look for something called hammer toe, and I don't know what that really means.
Yes.
So what does hammer toe mean?
Hammer toe, when you look at your toes, they should be straight.
Okay.
So when they bend,
Okay.
that's a hammer toe.
Oh, like the head of a hammer. It actually looks kind of like that. Okay.
Yeah,
All right.
okay.
Okay. All right. So one of the things you can help with are hammer toes. What about bunions? What are bunions? What does that mean?
Bunions are when the big toe shifts over and you have that big bump on the side of your foot.
Okay.
That's a bunion.
Only the big toe.
The big toe.
Only the big toe does that. See, we're learning something new every day. Okay. So
They have a bunionette on the pinky toe side,
Right.
but so
Okay.
they could both do it. But
right.
yeah.
The one on the big toe is bigger, and
Yeah.
it makes more of a. Have you ever gone to the shoe store and the reason that they checked, and you'll probably know this right off the way, sometimes people's feet aren't the same size.
Yeah, often,
right?
often.
So you go to buy a pair of shoes and there's like 7.5 and a 7, and I'm like, I need the 7.5.
Yeah.
And then you run around the store figuring out who stuck the wrong shoe in the wrong box. It's like, what's going on here? Chances are, because the person that took the shoe has a bunion.
Yes,
Right.
and people oftentimes get shoes to compensate for that, and they're too big, and that causes problems too. So, right, good fitting shoes are very important.
I was even talking to maybe about preventative wellness care for your feet. Like we go to the dentist and that helps provide, not getting a heart attack possibly, but taking care of your feet can also provide you not getting infections. So the second that you have a toe infection, how do you know, especially for people that are getting manicures and pedicures, right? How does someone know when it's just a normal toe fungus, or when they have a really serious problem they should go instead of a dermatologist but to a podiatrist?
Well,
Or do you treat both? Like, I don't even know.
yeah, I
so
mean,
I'm asking.
dermatologists can do that. We are usually a little more hands-on, where we can both prescribe different medications. We'll take cultures, but we'll remove the problem. Not too many dermatologists actually will do all that.
Okay, so that their feet can get healthy.
Yes.
And be in a good way. Do you feel a connection between the patients that you treat, especially those with diabetes, when they come in with a very severe problem, Do you feel that connection where you just want to help them?
Well, that is truly a passion of mine. From when I started managing diabetics as a subspecialty, I can't tell you how many limbs I've saved, and it's a fabulous feeling to have a patient come in with a wound. They've been told they need an amputation, and within weeks you can resolve the problem to not amputate. Sometimes there's conservative treatment, sometimes there's elective surgical treatment involved in these matters, but very often I'm able to reduce pressures, correct the areas in terms of the ability for the wound to heal, and then resolve the issue.
Dr. Stern, thank you so much. I wanted to make feet fun, and I think we accomplished that.
No.
But in all seriousness, when somebody does have an issue, they should call you right away for a consultation, and that'll help, right?
Absolutely, and preventative medicine is the best medicine. So definitely, all diabetics should be seeing a podiatrist. Hard to find diabetic specialists within the field, but they're out there, and I am definitely one of them. Give me a call. We have offices all over Nassau and Queens.
Excellent. And I know with your referral basis too, you know a lot of the people that have also kind of specialized from where you graduated from. So if somebody anywhere in the country needs help, they could call you, and I'm sure you could help find somebody for them.
Absolutely. And I will say too, the approach, especially with diabetics, is a team approach. It's the primary care doctor, it's the vascular doctor, it's the endocrinologist. Everyone needs to come together to take care of these people and make sure that they're safe.
Thank you so much for joining us. We've been living it up right here with Dr. Stern. And like I said, we want all of you to have happy feet.